Welcome to Startup Health TV. This is a special COVID-19 health innovation update. I'm Logan Plaster, editor-in-chief at Startup Health, and I'm here with Hunter Howard, the founder of the Global Pandemic Coalition. Hunter, thank you for taking a few minutes to talk with me about this new initiative you have.
Great, thanks, Logan.
Hunter, so you've been in this market, you've been in the digital health market for a while. You're part of the Startup Health portfolio with Hormone Therapeutics. Why start something fresh? I mean, you've got a lot on your plate already. You've got this global pandemic coalition. What caused you to really think about starting something new?
You know, I've been a digital health tech and entrepreneur before, so I've started a number of companies in this space, but I was almost patient zero in Dallas. And so I caught it very early on.
With COVID-19?
With COVID-19, caught it very early and had a very rough case of it. In fact, here I am 14 weeks after catching it, and I am still dealing with some of the after effects. Some people, they're done with it in a week. I still have tingling in my fingers. I'm still having problems with lung functionality. So I'm, for the most part, recovered, but I am still not 100% of what I was. And just going through the process, it was just kind of a scary, lonely, terrifying thing. And then it was, realizing just to know how little we knew about it, so how little the physicians knew about it, how, then also seeing kind of the response to it and expecting a federal response to certain things, but how complicated it was. And so said, went around and looked at my startup health friends, my YPO healthcare business friends, and said, we need to build kind of a better, better solution. We need to build a coalition of kind of the best in breed partners, and that we can help we can help drive better solutions and services that are needed right now. That's what drove this.
No. Okay. So you got it early. You're in Texas. What has been the arch of the disease there in Texas that you've witnessed?
In Texas was interesting. So I caught it early in Aspen, and so I was one of the first people back in Texas. Texas over the last couple of weeks has really seen more of a hotspot. Both Texas, Dallas, and Houston are two of the 5 biggest hotspots in America right now, and the reason for that is we reopened early. And what's fascinating is, so very much a Texas mentality. We are going to reopen. We are going to, allow businesses to thrive, and I support that. But the citizens of Dallas and Houston and Texas, we sacrificed for 3 months so that we could reopen. So we sacrificed so that we didn't put too much strain on the hospital system. That was the biggest thing, to make sure that people weren't passing away in wheelchairs in the hallways. The other thing was to allow the cities and the state to build up the capacity for contact tracing, for testing, for sentinel surveillance, all the different things that need to happen, so that if there is a surge, that we have the ability to be on top of that. And we've reopened a little bit earlier than most of the country. We are seeing the surge I think you're going to see in a lot of the country, and we don't have all of those capabilities built out, unfortunately.
Okay, so let's get down to the nuts and bolts of what the coalition is and what you'd like it to be.
Right. So what we did is it is a coalition of best in breed partners. So we are trying to figure out who has a solution and who has a need. And so we're building a marketplace of all the best solutions in the world. And we are actually already in 6 continents. Companies that have different solutions, from testing to tracing to PPE to really everything that you could possibly think of. We are inviting them into our tent, and we're saying, what are the solutions you can bring to bear? And we're bringing them to bear for governors, for mayors. We're bringing them to the employers. So let's say you're trying to figure out get your company back to work, and you want to do sanitation. We have a symptom checker that allows you to have every employee before they come to work say, here's my temperature. I have not been around anybody that's been infected. I am not dealing with any of these symptoms. Type of thing that allows you to have them come in and be confident to really develop health security within your company. So right now, there's so much health insecurity out there. Who has it? Who am I around? Who's not wearing masks? Masks are not being required in Texas right now. So there's so many things that we are trying to help build security around, really for employers, municipal governments, federal government. So that's, it's a coalition of the best in breed partners, and then trying to stitch, here's what we see as the best opportunities. And if I were to put everything together federally for a response, these are the best in breed partners that will do that.
So you are very in touch with the entrepreneurial community. You're involved with YPO, Young Presidents Organization, and with Startup Health. Between the two, how many startups or how many companies would you say are represented in those two communities?
Yeah, so it's those are the two primary, kind of areas that we're going through right now. And we have well over 100 companies from 6 continents that are developing solutions. What we're also finding in like the YPO community is of a company right now, the same way every mayor and every governor, they need to now become, their own. They're developing their own pandemic response to what's going on right now.
Mm-hmm.
So what used to be, healthcare for a lot of companies was, what was your insurance package for your employees? But people are now wondering, okay, how do I keep my patrons and my employees healthy? So we have so many of these companies right now that we are building. And one of the amazing things we're doing, we built a program with. In India, we're doing proximity tracing for people that have the illness, and so then you can find out, have you been in proximity to someone who, I'm not sure that's going to be available in the States anytime soon. I'm not sure that's something we're looking for, but in India, we both have that in municipal areas as well as within companies, within a plant that's building automobiles, to know, have you been in contact with anybody that has gotten sick? So we have a lot of these tools out there that the contact tracing is really the biggest tool. It's really, how do you scale that up? How do you get on top of somebody very quickly? How do you identify, isolate, and then help them quarantine and make sure that they're not getting anybody sick? That is the key functionality that needs to be developed to make sure that when somebody is sick, they're not getting anybody else sick as soon as we know about that.
Got it. So I'm envisioning like a big tent where you're saying, hey, everyone who's got a solution, come to be a part of the coalition of solutions. But you also said best of breed. So what role is the coalition playing in vetting and actually coming up with some sort of end decision, like this is our recommendation?
So we're building a marketplace right now. The marketplace is it's going to be a big tent for everybody who has a solution. You want to come in, you've got a testing solution, you've got a tracing solution, you have a different program. We want you in the tent because we're not going to be able to vet everybody. Sure. But we also are able to identify, these are the ones that are the best in breed. There are so many testing partners out there right now. You're hearing so many things about antibody tests where some are 100% specificity, 99% accuracy, and then others are well below 80%. So we're building a massive data aggregation also, and then on the testing side, it's going to help us identify, these are the best tests that are out there. Let's help also make sure that the funding goes for the best tests, and make sure the funding doesn't go for the tests that really are not as accurate. We, along that same lines, actually, we are building a program for a global herd immunity testing program. And so what we're going to do is work with the best testing partners that are out there. We're building a QR code app that goes on the phone, and the QR code is going to, so the antibody tests are interesting, right? So there's 2 ways to do it. One is a blood test in your arm. The other one is this disposable kit. We prick your finger and you put the blood into a disposable kit, almost like a pregnancy kit. But then it's a disposable kit. So most people are taking those tests, they're getting that information, but that information is not going back anywhere. And so these tests, these disposable tests, and we have one partner who we believe is the best in breed partner. This is a perfect example of who we've identified through this process already. They can do 1 million tests today. They are 100% specificity, 99% accuracy. And through a fingerprint, we could do a massive global herd immunity test that helps you understand who has had it, who has not had it. And then also, because these people are able to upload the information immediately by taking a photo of the results, we're able to collect that information. And then we have a series of questions we ask them afterwards about, what are your comorbidities? What are the issues that you might have helped? There's so much data that we're not collecting right now. That's one of the most disappointing parts. Data is going to inform our presidents, our governors, our mayors, everybody on what is happening. So we're building this data platform around this global herd immunity program that we think is going to be, we had a conversation yesterday. I hosted a podcast with the Director General of the WHO, World Health Organization, David Nabarro, and we had 400 CEOs from around the world who were asking him questions, and he is very concerned about where this is going, particularly in the third world nations around the world. He was just telling some horror stories about what's happening in Iran, what's happening in Bangladesh, what's happening in India, what's happening in Brazil. And so one of the questions was, what is the update on herd immunity? And we do not have a massive herd immunity testing program out there. We do not know. And we also don't know about the reinfection rates for people who may have had it before. And you're never going to know any of this information until you get out there, you start doing more testing. We collect who has had it, who has not had it, what issues have they had beforehand. And this is the type of information that will just kind of guide us. And we're so early in learning about this that we we're learning every single day. And that was from day one when I was with the top pathologist in Dallas. That's when I saw we know so little about this. I'm not sure who is putting their arms around this. And I looked to my friends that are healthcare, CEOs, and said, if it's not going to be us, who's going to do it? Let's band together. Let's create a coalition of the best companies in the world, and let's create a solution, and let's deliver them to people. And we're a nonprofit, and we are just trying to build a coalition of the best solutions for, for the world.
But it sounds to me like it is more than just a marketplace. It's more than just an aggregator. You actually want to create some data infrastructure that pulls things together. So like if you've got a testing company, you might pull in their data into a database and connect it with the WHO or whatever. You would actually play a central role. Is that right?
That's exactly right. So we're working with the WHO as what are the questions that we want to ask people so that we can not only find out who has had it, who has not had it, but once we have that, we've got an app where these people that have had COVID before, with the ability to communicate them and ask them questions about the duration, what were the progression of symptoms, and then also, have they had, are they diabetic? Do they have any lung issues? Do they have any cardiovascular issues? And then that data is something that we are, working with a number of different companies on to provide them to say, those guys are experts in that. We are trying to build a platform to then go out to the world, collect this information, bring this back, and help inform our decision makers. And that's by far one of our biggest goals.
Interesting. So you've been a CEO before. You're CEO now of Hormone Therapeutics. You understand the challenges of starting and running a business. I feel like one of the big challenges here with COVID-19 is just the enormity of the issue, the problem of trying to boil the ocean. How do you handle the fact that there are so many factors to the challenge and that every single region of the world is affected? Like how do you go after a problem that wide?
And creating a global pandemic coalition is the definition of boiling the ocean. That is absolutely it. But we have a group here of people here that are uniquely situated to be able to do something like this. And the reason for that is I am on the board of the YPO Healthcare Business Network. So this is 1,500 CEOs around the world. And these are people I have a relationship with. So we come together, we help each other out. We are healthcare leaders and CEOs of companies. And so being on this board and also being part of Startup Health, we have the unique ability to send out emails to people that we know, that we have connections with. So we're not just randomly trying to connect people. We're very uniquely situated with our relationships to be able to, reach out to them and say, who has something, who wants to be a part of that, and bring it in, kind of throwing that net out there for that big tent is something that we are capable of doing. And now it's how do we actually focus all that energy? And there's so many different solutions out there. So we're just trying to figure out what are the best in breed. How do we help them, filter to the top and understand these are the solutions that are needed. It's really interesting. So one of the things that we did do was we looked at the top 8 kind of proposals that are out there. So you've got the CDC, the White House, you've got Scott Gottlieb, you've got Andy Slavitt, all these people have all these great, really recommendations, the Safra group at Harvard. How should we do a phased reopening? And so they're doing very specific recommendations on, okay, you need 14 days of, reduced transmissions. You need to have X amount of capacity in your hospitals. You need to have, availability for testing, point of care testing in all of your hospital clinics. You need to have tracing and surveillance, sentinel surveillance, and all these things. So what's been remarkable to us is we've been going out there talking to employers, mayors, and governors is they know they're supposed to be doing something. They're all overwhelmed with how do they protect their citizens, how do they protect their employees. And so we're trying to then now take, okay, here is the guidelines from the government. Here are the guidelines from the think tanks. Here's what you need to do at each step of the way, phase 1, phase 2, phase 3, phase 4. Texas opened phase 3 and phase 4 well before we had, done everything that they were supposed to have done. And that's why you're seeing these hospitals right now. That's why Houston and Dallas, and the same thing with Scottsdale, Arizona. That's why these cities are blowing up right now. And so what we're trying to do is say, here are the guidelines that have been provided to the leaders. And we understand that, it's above the pay grade of most people to be able to really respond to a global pandemic coalition on their own island. So here are the support tools that you guys need to do that. Here's been what's recommended, and then we're trying to guide them, and then we're bringing in our partners that you guys need. Here's the testing partner you need for this. So here are the number of testing partners. Here is how you would do tracing. We're building up kind of very broad testing capabilities, tracing capabilities. We're also building a lot of technology. Tracing is a very manual attempt. And so right now, I think Scott Gottlieb asked for $39 billion for the U.S. government to be able to do the tracing that is needed to be able to contain what is going to happen in this country. So it's a very manual process of calling somebody, finding out who have you been in contact with, getting that information, and then contacting those 6 people, and then contacting the 6 people that they talk to. So there's a lot of technology that can be built to really collect a lot of information from the individual of who have you been in contact with, and then communicate out to that person of, we're trying to reach you. Here are the quarantine recommendations we have for somebody who is asymptomatic, is probably a very severe spreader at that state, and they need to quarantine and isolate themselves at that point. And we're not doing that right now. And so we have all these asymptomatic or pre-symptomatic spreaders right now that are out there that don't know that they're sick. And that's what the tracing side needs to be built up immediately on.
Got it. So you mentioned it at the beginning that you were close to patient zero there in Texas. You got it early in April. How does that give you?
First week of March.
First week of March. All right. How does that give you a unique perspective to lead something like this? So you founded the Global Pandemic Coalition. What do you understand about COVID-19 that somebody who hasn't experienced it might not?
Yeah, no, that's a great question. So I immediately, I was very open about it from the very beginning. And so I have now also become like a real resource center for a lot of people. Hunter's the guy who's had it. He understands this. And so I have spoken to probably 250 people over the last 14 weeks on people who have symptoms, people who have it, people whose family members have it, how to deal with it. So not only do I have my own personal situation where I know and that's the sickest I've ever been. It was awful. The body's a unique thing though. For everybody who's out there who's worrying about getting it, the body's an amazing thing that as horrible as it was, it's the sickest I've ever been. The back pain, the chest pain, the lung pain. I had it deep in my lungs. I couldn't lie down. It was so painful. But the body's amazing. And now I remember it as I remember that I was sick. I don't remember the pain. So the body, we're very lucky for that. And I was close to having to go to ICU. My breathing was very labored, but I knew I didn't want to go and get intubated. And so it was an early decision, and thankfully that wasn't. And I stayed at home, and I just kind of rested it out. But speaking to so many people over time, and you're finding so many people right now also that are still having effects 2, 3, 4 months later. They don't have it in their system anymore, but there's I still have tingling in my toes and my fingers and the lungs. And we don't know what it is. The CT scans that I had 2 weeks ago, they showed that I was clear, which was the good news. I was almost disappointed because I was like, no, there's something wrong with my lungs. Why aren't we seeing anything?
Yeah.
Like, no, that's good news. That means that there's nothing terrible that's happening there. It's just going to take time. So it's something I've just leaned into so deeply. The more people I talk to, the more horrible stories I heard. One of my best friend's fathers just passed away. He was, from COVID. There's just, we're just hearing so many horrible stories. It's real. It's real, guys.
Yeah. I mean, that's a profound but simple answer to the question. Just your realization that it is a serious problem positions you uniquely to head something like this up.
And the thing that I saw also was
it's not theoretical.
The thing that also is how little we've known about it. And so sitting there with the pathologist who got me into, I was trying to donate plasma, and it was 14 days after a symptom, and they go, okay, you should be checked, you should be fine by now. Let's go check if you have antibodies. And not only did I not have the antibodies built up at that point, I also still hadn't had my PCR test showed I still had it in my system. So you immediately start going, our top doctors don't understand this. We need more data. We need more information. And then just not seeing a response of, this is the group that's going to go and figure that out. I said, let's go help everybody figure this out. And that's our goal.
Got it. Okay. Last question. So you're a quick start. You're in, I would probably hazard a guess that you're in V1 of the Global Pandemic Coalition. What is What is V2? What does the summer look like? What are your hopes for the group?
V-Run right now is just getting together kind of, a coalition of the willing, the able, the interested, people with the best solutions. And we're trying to figure out who the best solutions are and trying to connect them with the people that we know that are needed. So we're building a marketplace, which is really the next part of everybody that is interested and has a solution. We want them to come in there. We want to put their marketplace in there, put them in the marketplace and build out really a massive set of solutions. We are, yesterday we had a podcast with the WHO Director General. We've got stuff lined up with Anthony Fauci and Scott Gottlieb also. So we are building out, on the policy side, getting the best in breed, the best knowledge. And then we're helping to, lead the CEOs within YPO. We had 400 CEOs yesterday talking to the Director General, asking questions about what they should do about their companies. And we are just trying to get in the middle and help as many people as possible. I think this marketplace is going to be the one that's going to be the most tangible for people in the startup health community. Come in here, get your solution, get it out there. Let us help you communicate that. And us really working with the governments, the CEOs, on figuring out these are the solutions that can help us develop health security, for our community, for our employees. And, we're just, we're learning every day and we're growing every day. And we're really excited about being a part of it.
So if I'm a healthcare startup and I've got a solution for COVID-19 across the whole spectrum, I should reach out to you and get myself listed on the marketplace. Is that the idea?
That's exactly right. So we are building the marketplace right now, and we're going to ask them to come get listed on the marketplace. We've put some information in the Slack channel for the startup health companies on how they're going to be able to do that. And then they can also reach out to me, Hunter, at Global Pandemic Solution, globalpandemiccoalition.com.
Hunter at Global Pandemic
Coalition.
Coalition.com. I'll put that in the YouTube description and people can reach out to you. Hunter, really appreciate that you're doing this work. I know you're, a hardworking CEO and founder to begin with. So to add this, I know it's a passion for you. And you're really bringing a lot to bear. So I really appreciate what you're doing.
Thank you, Logan. It's been interesting. While I was sick, a couple of things I was thinking about of what we could do. And every option I was thinking about my own company. I was just so drawn to helping us figure out a solution for this. And we're leaning in, and then the community of people just kind of is energizing, and we're just excited to be part of the solution.
All right. Well, we'll be watching to see how it develops, and we'll be checking back in.